and research. And today's webinar, we will be studying a module from the Health and Social Care Diploma Level 7, I believe, which is going to be managing people in health and social care. So what I am going to do is I am going to share my screen so I can show you what we have for today. So 1 second. Can we all see that on the screen? If you can, say yes, if you can see that on the screen. Thank you very much. Can you all see that on the screen? Can you see the presentation on the screen? If you can, just give me a notification in the chat box that you can see it, and fantastic stuff. Okay, so we're going to be talking about managing people within health and social care, and we'll be discussing a few things, and also this is going to be a very interactive webinar as well, because I like to talk to people and I like them to get their views as well. So let us get started. Yeah, let's get started. So first thing we're going to be talking about is understanding recruitment and selection processes within health and social care. Now, within the health and social care sector, there is a lot of recruitment happens every single day. And you know, the high turnover of health and social care is pretty much what we are seeing now. You will see in the news that every single day there's always notifications going out that they are looking for staff. They're looking for new people to come on board, or you may see staff that are leaving as well, and you know, they want people to come and replace those people that have left. So what we're going to be looking at is how people recruit in the industry itself, and how people are selected for certain jobs. So before I get started, how many of you have you been in a recruitment, have you ever been recruited for a job before? Have you ever been put through a particular recruitment process? If you did, what was involved in that particular process? Can I? Okay, so that's wonderful. So yeah, what was involved in that particular process? Because in that particular process, there's a lot that happens. There's a lot of behind the scenes work as well that goes on. So one of the things we want to look at is why. So as you can see, within the health and social care sector, there's there's a huge amount of people that join the industry today. So certain people would be nurses, doctors, GPs, consultants, social workers, care workers, care supervisors, care managers as well. I'm sure you can think of other professions within the industry as well. Now, as part of that, they will all go through a different selection and a process. Now, it may look the same, but it's not. The way that they are recruited and selected is not the same. It is very, very different. So depending on your role and your position and the setting you are going to work with as well, it is always rigorous. It is always a rigorous process. And for employers and like senior partners and their senior partners as well, it's an even more rigorous one as well. And so as they are recruiting as well, they've got to make sure that the process that they go through, it means government guidance and legislations around recruitment as well. And furthermore, another factor is, you know, they actually have to, then another factor they have to look at is how they actually recruit. Where can they recruit? Who should be involved in the process and who should they consult? So let's get into it. So, okay, when it comes to recruiting people, before we go into it, as I was saying before, you can use the chat box if you like, or if you want to unmute yourself. But when you recruited for your position, how many stages did you have to go through? Did you have a first interview, second interview, third interview? Did you have a trial? What was the recruitment process like for your particular job? So feel free to use the chat box as well. I'm just going to have a sip of my coffee quickly, because when I ask about what you had to go through, in some jobs you just get in straight away. So you turn up for an interview, you may sign some papers, and you get a job straight away. But in some jobs, in some other jobs, it may not be like that. You may have certain jobs where you have your first interview, then you have or not even that, you apply for the job first, and then after your application, then you have to wait to hear back from the board about whether they're going to go ahead with your application. Then if they do, then you may have to go for an interview, let's say, and then if you attend that actual interview and they like you, you may have to go and meet the board or the separate directors of the setting, and after that you may have a trial or a probation period, and after that probation period, that's when you may sign your contract. So depending on your job and depending on the setting as well, it will always come down to that. And you know, it will always come down to, like, you know, yeah. So yeah, it's okay. Shortlisting, online interview, screening, written assessment, offer letter, joining. See, there we go. Different, you know, there's different ways that you can get into the job, and there were different ways of, you know, attaining a job. Like myself, in one of the other jobs that I had before this one, I literally turned up to the interview on that particular day. I showed them my documents. I had the interview on the day, and I was in straight away. Now, for one of my other jobs, it was quite more rigorous. So in the term that I had to go through first interview, second interview, pre-screening, another screening process. I had to do security clearance as well, and it was just a whole process. So, you know, in certain jobs you get in straight away, but in other jobs it's a long process. And as we're on that process, when it comes to recruiting people, it's normally likely that, you know, that like certain managers, leaders, and also senior partners as well, they will come together even before they start recruiting or you know, looking for certain types of people. They want to see what type of person they would like to recruit. So Carol, why do you think it's important that why do you think it's important they look for a particular type of person? Like, why do you think it's important for them to screen specific types of people? Would it be for do you think it would be because they want to make sure there's a balance, or could it be that because the role is so important and it's very, you can use the chat box, the chat box as well, if you like. So because of that, you know, they got to say we need the right people to join the team, because let's be honest, you can start a job, but then you may not be the right person for the job. So they need to make sure that the type of people they are recruiting themselves, it's like, yeah, they're legit, they are good, and yeah. So yeah, presentation purposes, yeah, because if you have to screen them, got to make sure they're good for the, you got to make sure that they are good for the job, don't you? So yeah, so managers, leaders, senior partners, they will all come together to discuss what type of person they would like to recruit for the job. So now the next stage in that process really is to put together a job description for that particular job. So I'm sorry if you've ever looked at a particular job description, let's say, in that job description, you may see certain things, like the things you have to do on a day-to-day basis, some of your roles and responsibilities. Then you may see you know, some of the skills you may need, some of the knowledge you may need as well. And then you may see like the benefits, and you may see, you know, who you are, what do you call it, who your upline is, or who you are going to be reporting to on a day-to-day basis. And that is a very important aspect for any person who's applying for the job, because they're gonna want to see, okay, boom, who am I going to be working with? Who am I going to be? What am I going to be doing? And what do I need to know in order to do the job? Because nine times out of 10, you may be able to get the job and get training on the job as well. But in some jobs, they expect you to know certain things, and they expect you to have certain qualifications as well. So when it comes to, you know, when it comes to actually putting the job description together, it's a very important thing. And then, like we discussed as well, they would all have to be putting what would they actually be doing? Like, what would they be doing on a day-to-day basis? And then, as part of that, development comes into it as well. Is there a route of progression for the people that are joining that are coming to join your setting? Is there a clear pathway for them? Can they have a clear pathway? Can they come into the job tomorrow and say to themselves, okay, so in let's say about a year's time, or 2 years, in 2 years time, I can be a certified consultant, or I can be a occupational therapist, let's say. So what do you guys think? Do you think that having a route of progression is important for any job in the health and social care in this industry? I believe it is. What do you guys think? Do you guys think it's an important thing? Do you that have development is important for do you guys think that having you know, having having development is important to a person's job? Do you think that the person wanting to join the job is wanting to see whether they can develop or not? So what do you guys think? Let me know in the chat box. Do you think it's important that they are developed within the job? Okay, perfect. Okay, so okay, that's cool. So we've looked at, you know, like, so we've looked at certain, yeah, it's important because personal development as a manager, as a leader, and as you're going into that role too, you need to know that if you're going to have certain staff members in your team, you got to develop them as well. And that is what senior partners have to look at when they are putting together the actual job description itself. So they may come together and they may decide, okay, so once you hire person A, we're going to get him on some training. And then what we're going to do for person A is we're going to give him a lot of other training, and then we're going to see what he is, or then we're going to see what he is doing. So yeah, let's also now get into the next part of it as well. Let's also get into the next part of it as well. So we've looked at, sorry guys, so we've looked at you know, the route of progression, job description, and who would be involved. When you put the job description together, you also need to think about what would make them stay within their job. You got to think about what would make them stay, what would make them want to progress within the actual company itself. Because don't forget, as part of selection and recruitment as well, it's all about the vision of the company too. So I'm sure, like, when you've had an interview with someone, let's say, they may ask you a simple question like, why in 5 years time, where do you see yourself? Now, sometimes that's not a trick question, or actually kind of it is, because they want to see whether you have a vision of staying in that particular company for the next 5 years. And that can normally determine the type of person they're going to recruit as well. Because there's two types of people, well, there's three types of people. There's the first person who will come into a job and they will leave in like 2 to 3 months. Then you've got the second person who's good, does his job, and stay for about a year, 2 years, until he finds a better place somewhere else. Or then you have the third person who's committed, always there, and is really on board with the actual company and the vision itself. And they are the ones who will go forward and lead the company itself. So you got to look into the factor about what is likely for them to stay. What are you going to offer them? What can you offer them? Can you offer them training? Can you offer them a chance to you know, shadow certain leaders? Would they be involved in meetings? What can you offer them that will attract them to stay with the particular company? And in job descriptions as well, what benefits are you going to receive as well? What benefits can you receive? So sorry guys, I got a bit of a sore throat. I got to drink my coffee. Okay, that's good. So yeah, so I mean, it's an important factor. It's a very important factor that you know what to offer them, that you know what you can do with them as well. So let's move on. Do you have any questions at this stage, guys? Or shall we leave it until the end? So, okay, that's cool. Okay, so let's now get into the juicy part of it. In the recruitment process, in the recruitment process, you are going to need special expertise. You are going to need special expertise around the staff that you are going to require. There you go. You see, benefits of the company. Carol says her company offers medical cover, family sponsorship, and incentives. And you see, that is the type of thing we are looking at. When you go and apply for a job, let's just go back to the other one quickly. Let's go back. Previous, no, let's go back. Sorry, guys. We're just going to go back to that last one. Yeah, so, you know, so Carol brought up a very important thing about medical cover, family sponsorship, and incentives as well. And so for a person applying for that particular job, obviously they're gonna take that because they can see, you know what, that's legit, fam, that's legit. And that will help me within my job too. So sometimes when you're looking for a job, look at what they are offering you first. Look at what they can offer. Look at what they can offer you before you then decide to do I want to take this job or not. So look at it very carefully. Look at what they've got to offer you, and then decide, should I offer myself to them? But we will talk about the interview process later on in the slide as well. So if we move on, so in the recruitment process, there is going to be a time that you know there is going to be a time that you will need special expertise. You are going to need special expertise around the staff you want to hire. And so, you know, so you are going to need special expertise around who you have to offer and what you want to do. And so one of the first things that you need to know is when you're looking at people you want to recruit, you may need to look at outside agencies. So one key expertise is the DBS, the Disclosure Barring Service. Now, before that, it was called the CRB, Criminal Record Bureau. Now, as part of that, the Criminal Record Bureau, it just stated like whether the person was clean, whether they had any convictions, whether they had any charges against them, or like if they've been in prison, and you know whether they were fit to do the job, or did they have any driving penalties against them? Just the things that were on their record that might weigh up whether they get the job or not. Now, the DBS now is very different. It's very more rigorous. Disclosure Barring Service is a service that really breaks apart a person's past. So if you've ever completed a DBS, have you done a DBS before? You can put that in the comments if you like in the chat box. A DBS is basically something that you know, a DBS is basically something that highlights everything you have done. So just like a CRB, but it will also bring into other aspects. So if you were going to apply for a role with children, let's say, are you on a child protection register list? Is there any sanctions against you? You know, have you ever been interviewed by the police? Have the police arrested you? What did they arrest you for? There's certain things on the DBS that when you go for a particular interview now, this is what they are going to be looking at. And also things like gross misconduct as well. If you've had a previous job, if you've been sacked for gross misconduct, let's say, or something serious, that goes on your DBS as well. So sometimes in the recruitment process, before you are even selected to go through a trial and whatnot, they will take your DBS and to see whether you are legit and fit for the job. And so that's one of the key expertise where they would have to look at. Other places would be the local authority now. The local authority is a key one, because every person who's got a job in a local authority remit around health and social care, they are known to the local authority as well. So they may contact them too, and to ask them, okay, we're looking at hiring so-and-so, what is he like? And then they may go and ask your former employer as well. And so your former employer is special expertise as well, because then they know you, and they know the type of person that you are as well. So let's carry on. So selection within that process now is very key, because of course you've got to consult their expertise, and they will also have a key role in the local area, like your local authority. Different partners out there, different people who have different jobs as well. And it will also need people's agreements as well, that this person is fit for the job, and you can hire that particular person. Now, we're now going to look at legislations and framework needed to help with the recruitment process. Which ones do we need to follow? Now, there are really big legislations and frameworks that you need to look at when you are hiring people. So in the chat box, or you can unmute yourself, what legislations and framework do you think are needed to help with the recruitment process? What do you think? What do you think, guys? Because there are certain legislations out there that that it needs to, that it's good. It's good. So okay, so the first one you got to look at is the Health and Social Care Act 2008. And so the Health and Social Care Act is basically an act that was brought into place, and it also brought into play the CQC, which is the Care Quality Commission, and that is where they audit every single setting within the health and social care industry. And their focus is providing assurance about the safety and the quality of care for patients and service users. So when you look at the recruitment process, and you look at CQC as well, it will then give you an indication of the type of service that is being provided already, and it will give you an indication of what we need to do to actually improve on our service. Hence, they will go and look for new people to help them improve that particular service. And so another one we got to look at is the safeguarding Children's Act. Now that one is a very big one. That one is a very big one because, you know, when you look at safeguarding, let's say, and you look at a safeguarding, and you look at other parts as well, then you will then begin to see if we're hot on safeguarding, let's say, we need to look at the type of people that we are recruiting as well. And one of them is, another one of those is the Care Act 2014 as well. So that is like it's a legal framework that is for local authorities to see how they can protect adults who are at risk of abuse and neglect as well. And when you're looking at recruiting people as well, if those people have had a history of abuse, neglect, or they've got something on their DBS as well, that's what you have to be looking at. You have to look at what they have said, and then you have to now bridge that gap. Okay, are they the right people to bring into the company itself? So what we now want to look at is other, we want to look at other other stuff as well. So one of the other things as well is the Equality Act 2010. Now the Equality Act is another legislation needed to help with the recruitment process. Now the Equality Act 2010 is very big, because what that is saying is that, you know, if there's any discrimination or in the recruitment and the selection of employees, that in itself is not on, it is illegal, you know. But hey, it's still a real thing in this industry today. But basically the act is protecting people with certain characteristics, that they will not be discriminated against, and they will have an equal opportunity to have an interview, to go through the selection process, and to possibly get the job as well. And so, you know, and so this one is basically, it is very, you know, it is very deep, and it is very needed within the industry today, don't you think? So, sorry guys, my throat, dear. My throat is atrocious today. So yeah, so that's basically what the different types of legislations and frameworks that you need to address. So let's now look at another piece of framework within the recruitment process is GDPR. So that's the General Data Protection Regulation. Now that the GDPR is basically when you are recruiting people, when you are recruiting different types of people, you need to let them know about the information that they give. What would you use it for? What are you going to use that information for? Is it for a specific people, or is it just for their records? So things like your name, address, date of birth, where you live, where you've worked before, who will that be given to? So you got to think about that as well. So let's move on, guys. Let us move on, guys. Let me have a coffee quickly. Yeah, that's good. Okay, so let's carry on. So before we carry on, guys, what other legislations and frameworks do you think we need to follow within the recruitment process? What other ones are you familiar with? Because there's many, there is many out there that as managers, leaders that we need to follow and we need to have a look at. We need to have a look at as well. Another one is the Children's Act as well, because within certain elements of that as well, it will detail on what your requirements are towards children. So so yeah, let's get into it. Let's get into it, guys. So we're going to move swiftly on. Okay, cool. So let's get into this one. Let's get into it. Let's get into it. So let's get into the next stage of it, where we are going to be talking about how you're going to select people, the selection process. Now, I want you to look at the bottom of the screen. I'm going to read out a statement, and then we're going to discuss that particular statement. The statement is, don't just fill the vacancies, fill them with the right people. Now, I'm going to say that again. Don't just fill the vacancies, fill them with the right people. Now, if you were to remember a couple of slides before, we were talking about the importance of screening people and making sure they are the right fit for the job. And now this statement is basically reaffirming what we have said before about not just filling the vacancies itself, but always filling them with the right people. And that came from Claxton House of Atlanta Healthcare, a residential care provider. Now, that statement, if you want to break it down into two, don't just fill the vacancies. So within that, you can see that they are pleading with people who are recruiting the staff into the job. Don't just recruit staff because you need to fill jobs, you need to fill vacancies. Bring in the right people. Now, as we said before, the right people, they have to be screened. They have to go through a job process. They have to go through a rigorous process to make sure they are right for the job, don't they? And so, when you want to select people for a job, you are going to have different approaches within that process. So you've got to look at certain ways you're going to select people. Will you select people in-house, so within the company itself, or will you go out of house? Now, that's a very important thing, because sometimes you can recruit in-house. The people in-house, they know the company itself, they know who they are talking to, they know the staff, they know the customers, they know the clients as well, and plus they know everything about the company itself. So 9 times out of 10, they would be the best people to go for. Or you could go out of house. So you may look at other, let's say if you work in a hospital, let's say, and you have a position for a surgeon, you may look at another hospital, let's say, and you may approach a certain surgeon in that particular hospital who is well known in those particular circles. Or there's something called talent pools as well. So talent pools is where within let's say you want to become a surgeon, there's a talent pool of surgeons, and you as a recruiter, you look at that talent pool and you say, let's get him from there and we bring him into the job. So that's how you can look in a house, or you can go out of house. Or are you going to look at local partners, or are you going to look at other sites? So Indeed or LinkedIn. And that's very important, because when you're going to select people, sometimes you have to look outside, and you've got to look at various other places as well. So you could have a wide range of people that you are going to recruit and you are going to have a look at as well. And so there's many approaches that you can utilize, but are they good? Are they good approaches? Are they ones that are very effective for the job? So you want to look at, is my approach to recruitment a good one, or is it not a good approach? So as we said before, don't just fill the actual vacancies, fill them with the right people. And when you fill them with the right people, you will find that the people receiving care, it makes a lot of difference. It makes a huge difference. So let's carry on. So now, now we're going to look at child abuse and serious case reviews. Now, people may say, what has that got to do with recruitment and selection process? It's got a lot to do with it. It's got a lot to do with it. So child abuse and serious case reviews, child abuse and serious case reviews. Over the past couple of years, there has been a lot of case reviews, and some of them are very familiar. So you have Baby P, you have Victoria Climbié, and you've got Tia Sarp as well. Now, I'm sure you've heard of other one, like Baby Arthur in Birmingham as well. He's another one that we can add to the list as well. Now, over the time, there's many more people, and, out of those case reviews came a lot of policies and procedures which surrounds those particular serious case reviews. Now, it is just this week, it was announced that the mother of baby P is going to be released from prison. Now, we've all got politics around that. We've all got our own opinions around that as well. But 9 times out of 10, you got to look at that in it. So let's look at some of the acts around in serious case reviews. So some of the serious case reviews that you can also link it to the legislations as well. Is one of them is the Safeguarding Vulnerable Groups Act 2006. Now that is basically an act to safeguard vulnerable people. So it may be adults, young adults, adults with a disability, young adults who have a disability as well. Or, it could be young adults who are leaving care as well. Young adults who are leaving care as well. So another one is the Care Act 2014. That again is a act that was brought out of the serious case reviews, the serious case review as well. The Children Act 2004 is also another act that was brought as a result of those serious case reviews. And now the reason why that was brought into play is because, the reason why is because it happened because of the Victoria Climbié inquiry. And the reason why it was brought into place is because there was a report by Lord Layman, and in his report, he said in his report that, you know, that everybody who's working with a particular child has a duty to report any maltreatment or any things that they have spotted to the relevant parties. So you may see that as a multidisciplinary team. Everybody in the team has a responsibility to report what they have seen, right? And that's one of the important things. And just before that, before the Victoria Climbié case happened, we saw that people were not sharing relevant information to relevant parties. They were not sharing the right info, and that is what happened as a result of Victoria Climbié dying. And so another one is the Children and Social Act 2017. Now, that in itself is another. That in itself is another one. there. So another one that in itself is now looking at the looked after children. Is now looking at looked after children who are in care. Now, when you look at people who are in care, sometimes they don't have the voice about their care. So the reason why that act was brought in, it was brought in so that they can improve decision making and they can support looked after children who are in care, make decisions about themselves. And so it also, you know, it also brings together different parties and different partners as well to be able to improve child protection as well. And also it also helps promote safeguarding too. So it helps bring about safeguarding within the industry as well. And another framework legislation is Working Together to Safeguard Children 2018. Now that one is a very big one, because when we look at safeguarding children and working together, 9 times out of 10, it will take the parents, carers, schools, GPs, social workers, local authorities, everybody working with a particular family to work together to safeguard those actual people. And you know, it's a very important thing that we work together to safeguard children. So, and that is why there's certain that's why there were certain processes, and there were certain things that we have to look at as well. And that is why when you are recruiting people and you are selecting people for a certain job, that is where the things like the DBS come in, the local authority come in as well. This is where when you look at the special expertise as well, who are you going to bring in? Are they going to work together to safeguard children? To safeguard children? Then you look at the history, DBS. Are they someone who's had previous run-ins with social services before? I hope that's all making sense, by the way, guys. If it's not, put it in the comments and we can discuss it at the end. So in the first section, let's just go over what we have discussed. So we've discussed, fantastic. So at the beginning, we discussed about, you know, the huge number of people joining the industry today, and we have also looked at the type of process it would need for someone to be recruited into a job. We also looked at you know, how they should be recruiting people. We then looked at, we then looked at who would be involved, why are they involved, what type of development there should be as well, and we also looked at how you can make them stay in their job. And then the next thing we looked at as well is in the recruitment process, who do you need to consult about your recruitment process or the people you are bringing into the job? And just like we saw on this particular slide, they all married together. Because if you look at those particular jobs, as a result, people lost their jobs because of those serious case reviews. Now, if it wasn't for the serious case review, those people would have been left in their job they would have been left in their job. And, no one would have been any wiser. So these serious case reviews, they really do enforce about a person's job, don't they? So, and then we also discussed about having the right people within the job as well. Having the right people to come into your job and to work with you too. And so, and then we also looked about child abuse, serious case reviews, and what you can do to improve your service. And we've also looked at some of the acts that came out the serious case review as well. So if we now move on, we're going to look at another aspect of health and social care and what would be available. So let's look at the next section. We're going to be looking at career development opportunities for individuals and training as well. So one of the things we need to understand is that as a manager or senior partner, as part of the job, part of your job is to help develop your staff within their role. And that is something we briefly discussed in a few slides before. Part of your role or your job is to help develop your staff within their role. Now, there's two particular areas. You have individual training and you have group training as well. And within that, you will have to come up with ways to help develop both. So why is it important to develop your staff? Why is it important to be someone, a manager or a senior partner, who develops their staff? So before we carry on, have you been on training programs set by your manager or a senior partner? Because I believe, because it's peak, isn't it? So yeah, you gotta so yeah, you have to look at them people, in it. So yeah, you got to look at those people, in it. So you got to look at it. Are they, as you develop those particular people, how are you going to develop them? So there are many ways that you can develop your staff. So individually now, I think it's key, because you can develop your staff in a number of ways. So you can develop them one-to-one. So you may be talking to them one-to-one, you'll have your meetings with them, and you'll be basically sharing with them what you saw, and also you'll be showing them what you want them to see as well. And I believe that is very important, those one-to-one meetings are, because you are able to get across how you want them to develop within their job. Now, when it comes to group, the group, You can set targets for the group as a whole. So it can be just a team of 5 people, a team of 10, a whole team, a whole department, or maybe the whole everybody within the setting needs to be developed themselves. So within that, you can develop them in many different ways. So you can set objectives, you can set targets, personal targets and team targets. You can have performance reviews, or you can share benefits around meeting specific goals. So if we look at each one, we'll break them down quickly. So objectives now, objectives are very key, because when you meet with your staff one-to-one, you can set them objectives. These are things that they have to meet. So in your particular job, what is it you want to be doing? And then you will look at what you want the certain outcome to be as well. So when you look at objectives, it's basically the reason for you doing a particular thing. So if you're getting them to shadow a particular member of staff, let's say, that's what you should be getting them to look at, innit? Are they going to be, so you get them to look at certain members of certain members of staff in it. When you look at those objectives in it, you look at those particular objectives, fam, and you think to yourself, okay, so let's set yourself some objectives. Now, targets are another one. So targets, personal targets and team targets. So you can set them specific targets over a period of time. So you may set them specific targets in many areas. So it could be communicating with specific type of people. It may be their work. It may be, it may be to do with time management. Maybe it just like personal targets for them to meet. And then you've got team targets as well. So team targets, it could be that everybody within the company, they must apply for their DBS by next week or next month or next year. Or another team target, everybody must be educated to a level two standard, or everybody working within the team, they must have had 2 to 3 weeks training around their job. And so you will give them certain targets that they have to meet, which bring us onto performance reviews. Now, performance reviews are big because performance reviews are big because they're almost like one-to-ones, but performance reviews are big because like you'll be looking at them and you'll be looking at how they have performed. And so those performance reviews, you can look at them in certain different ways. So you can get advice from staff, people they work with. You can get advice from clients, uplines. And then when you have a meeting with them, you can show them reviews from certain types of people, or you can get reviews from uplines as well and other supervisors who have seen them work. Reason being is that for you to help a person develop within their role, you need to help them review their particular performance, don't you? So yeah, you need to do that. And then you've got to look at the benefits around meeting specific people as well. So what are the benefits of meeting specific people? What are the benefits? Now, if you look at you look at those particular benefits, don't you? Now, when you ask people to meet specific goals, there'll be benefits, right? So if you've asked your personal, you've asked your person who you develop them one-to-one, what if you've asked your person one-to-one, they need to be trained to a level 2 standard. It could be that you want them to be qualified and competent within their role. So yeah, that's basically each one broken down. Now, within that, there are also several opportunities that you can develop yourself within the health and social care sector. So some of them, some of them are in-house training, shadowing, shadowing, in-house training, being on the job as well, on the job training, and then also other development paths such as job promotions and working with different partners as well. So you can put in the chat box, but in your role, what opportunities do you have as part of your job? Like, what opportunities are there for you in your job? Do you get to do training in-house? Do you get to shadow other members of staff? What can you do as part of your job? If you want to be developed, what can you do as part of your job? Let's have a look at that, because I think it's important. It's an important aspect, isn't it? It's a very important aspect. Sorry, guys, I need to have some water. Because my throat is atrocious, actually. So yeah, what would you say is important? Would you say it's important to would you say it's important that you need to would you say it's important? Because I believe it's important as well to have opportunities in-house as well as out of house as well. Don't you think, guys? Don't you think? That's perfect. Okay, guys. So let's carry on. We could talk about other bits. So in your role, you may also have other things like job promotions, and you're going to work with other partners as well. So in your thing, you'll have job promotions, and then, so this is clear, you may be promoted to a job, another job, or maybe in another setting, or in another hospital, or another care agency, or another job higher than your current job, right now. So let us now look at the other part of career development as well. As part of your career development now, there are also times where you will need to identify other plans for your career. Yeah, that's good. So you said weekly departmental training, and then you get staff and way to interact with other colleagues in other departments. That's good. That's good, because that's helping you get exposed to different parts of the industry, isn't it? And that's a very good thing. That is a very good thing indeed. That is a very good thing indeed. So let's carry on. Let's carry on, guys. Let's carry on. And we will talk about some other stuff as well. Okay. So yeah, let's carry on. Let's carry on. And that's very important, isn't it? It is very important, I should think. Very, very important, isn't it? So now, as part of your own career development, so this is you as an individual, as a person now, you as an individual, you would need to identify what plans you have for your career. So when you are looking at different opportunities now, you need to look at are those opportunities going to be legitimately good for you? Are they in line with your vision? And are they in line with what you have planned? Now, with every opportunity, you may need to put it under the SMART strategy. Now, SMART is specific, measurable, is it achievable? Is it realistic? And you know, time, and is there time as well? Is there a time limit to it as well? You can also put yourself through a SWOT analysis as well. So as we said about, you know, developing staff, you can get each of them to get themselves through a SWOT analysis. Now, the SWOT analysis, just like, you know, looking at what your strengths are, what your weaknesses are there opportunities, what are the threats? Are there any threats to those opportunities? So for example now, guys, if you were to apply for a job as a care supervisor, let's say, you can look at what threats are there. So could be, are you qualified in that particular area? Are you qualified to do that job? Are you qualified? Do you have the right skills to do the job? Do you have the right knowledge to do that particular job as well? Well, that's hot. So yeah, you got to look at all those things in it. And so you got to look at all these other skills as well. Like you got to look at, you know, if you were to apply for a job, then you got to look at, do you have the right qualifications for yourself too? Then you got to look at, are you competent? Have you been through training within your job? So as you put yourself through that particular SWOT analysis, you will begin to pinpoint areas that maybe like you can work on as well. Like you can look at ways that you can work on and that you can do together. And so looking at identifying areas of your development is very key in how you work and how your boss or your upline begins to work with you as a particular person. So let's move swiftly on. And so, the next part of it, the next part of that is when you are going to not necessarily no, Carol, not necessarily no, because there's qualifications don't necessarily equate to knowledge and skills. Reason being is that you may have, let's say, you may have a qualification in health and social care. So let's say you've got health and social care level 7 qualification. Now, you may not, so you got your qualification, you're qualified, certified, and they deem you competent. Now, knowledge and skills is different because you may be qualified, but what do you know? What skills do you have? So, do you have good communication skills? Do you know certain types of legislation as part of your job? Is your conduct good towards your staff members and to your colleagues and to clients? What is your presentation skills like as well? Are you able to present yourself in a certain way? how do you talk to people as well? How do you talk to people? And so all of that can be, all of that can be ways where qualifications don't necessarily equate to knowledge and skills, because like you said, Carol, attitude and presentation matters most. You may have people who have a qualification level 7, let's say. You may have someone who is qualified to the max, but the other side, their attitude lets them down. So sometimes qualification doesn't really matter. Well, it does. So you can show yourself you're competent, you are qualified. But then when you're actually on the job, like you're actually doing your job on a day-to-day basis, what you do on a day-to-day basis matters most. Because nine times out of 10, if you're working with a client, let's say, they want to know whether you can communicate with them. They would like to know whether you know about a particular disability, or they would like to know whether you've got experience in a particular field. You may be qualified in it, but do you have the experience? And this is where, when we looked at other, when we looked at the previous slide before, we were looking at bringing in the right people, because sometimes don't just ensure they are qualified for the job, make sure that they have the right attitude and the right skills and the right knowledge as well. Now, in certain aspects, as part of your job, you may need to know, in part of your job, you may need to know, in part of the job, you may need to know about certain standards that applies to your job. And now those standards, are standards that you have to meet for your job, right? So let's now look at another part of health and social care and recruitment and selection. So within your job, part of you analyzing those particular opportunities, you got to think about the company now. Does it match the organization structure? So we talked about in previous slides, when you're going to recruit certain people now, asking them what their vision is. Do you see yourself here in 5 years' time? Because when you're going to recruit people, you want to have people who are going to fit within the structure of the organization. And then also, as part of analyzing your opportunity as well, is you've got to think about, is there progressing within the company in a period of time? So as part of development within your company, let's say, look at the progression now. Are you able to look at, are you able to progress, to have the chance of getting a new job, or being able to train to a higher rank? Are you able to take that job and and really apply yourself at a higher level? Or do you have the opportunity to train with other partners, with fellow people that you work with? Are you able to have the opportunity to get higher training? All of that is what you've got to look at when you analyze those particular opportunities at hand. And they are very key, because as part of your development, 9 times out of 10, you would want to know if that progression is good and it will benefit you as a person, and will it benefit your team as well. So now this bit is now another bit as well. As managers, like, so if I'm a manager, Carol, if you are a manager as well, we as managers, we need to assess whether the opportunities are suitable for the individuals, so the members of staff that we are responsible for. And so when we are looking at specific types of training, like safeguarding training, communication training, training around other disabilities as well, or we're getting them to go offsite to learn different skills and knowledge. We got to look at whether it's suitable for those individuals. Is it suitable for their development at hand? And is it suitable for them as a whole? And then you got to look at, is it going to benefit their career if they do so? Will the individuals benefit from that particular opportunity? So if they are going to shadow a senior partner, how will it benefit them? How will it benefit them? And why will it benefit them? That's all the things you have to look at. Why will it benefit them? Why will it benefit their career? Now, in the previous slide, we said that as managers, senior partners, it's our responsibility now to look at their development over a period of time. Does it fit their vision? Does it fit your vision? And does it fit what they want to do in the future? And so this is everything that we have to look at. So let's now move on to the final part. So let's now look at understanding performance management in health and social care. So before we do that, we're just going to have a recap quickly, and then we'll get into this one. So in the previous slide, we talked about training and career development as well. So we looked at the types of development there is. We looked at why development is important for those individuals, how you can help them develop as well, and why they would need to, why they would need to have some form of development. So let's have a look at let's look at this, and then we'll have some time for review and question and answers. So when we look at performance management now, we're looking at performance and managing the performance. And performance is how you do your job on a day-to-day basis. So it relates to how the person is performing in their job. So day-to-day, you work with individuals, and you work with clients, and you work with several other people within the industry, let's say NHS. Now, if you want to measure someone's performance, there were different techniques that you can use to measure the person's performance. Now, as part of someone's personal development, this is a very key aspect. The reason being is that it relates to their everyday job. It relates to what they do on a day-to-day basis. So when we look at a person, an individual, there were several ways that you can gain understanding about their performance. So let's think of it as we mentioned those particular standards. Now let's see whether they are meeting those particular standards within their role, and how do they marry together, don't they? So you can include certain types of techniques such as supervision, developmental reports, like we said before, completing the SWOT analysis, have regular reviews, and you can ask questions as well. So supervision is an easy one. So supervision is a thing of you doing your job and your supervisor is there to look at how you are doing your job. So they won't, there's two types of thing. There's formal supervision and there's informal supervision as well. Formal supervision is when you set a date and you set a time, and within that you will set certain tasks that you want to show them, or like your supervisor wants you to show them. Informal supervision now is different. So they may not tell you when they come in, but they may just come to the back of the class, or they may just stand at a distance and watch you do your job. Maybe they will just look at your job and they will just see how you do and take notes. And that's it, finished. Development report. So 9 times out of 10, after you have done your supervision, or they have watched you do your job, this is when you will see, this is when you will be able to see what their reports are. So the reports that they have, it may form part of your developmental report. So they will show you, okay, and you done well, you done good, but this is what you need to do better, or this is what you need to improve as part of your job. Another area would be, they will say whether you need to do any training, or you will need to do, you will need to complete certain other training in order to do your job, or they may get you to do a course in a particular area. Now the next bit is to complete a SWOT analysis. So this is what we said about, strengths, weaknesses, opportunities, and threats. So as you, so within SWOT now, performance management, strengths are what you are good at. So when they look at you, they will say what your strengths are. So you may communicate well. You may you may have a good eye for judgment. You may suggest new stuff, new ideas, and new ways of working. Then you've got your weaknesses. So this is the things that you may not potentially be good at, but if you have the right training, you can be good at. Now, opportunities are ways of you can develop yourself. But the threats is just that, it's a threat. So you may not be able to do that in that particular setting. You may have to go to another setting, don't you? Now the next one is you will have regular reviews. So the reviews that you have are very important because of the fact that as you have those regular reviews, this is when you are able, or the supervisor or your upline is able to share how you are getting on. And then this will give you an opportunity to share how you think you are getting on as well. And whether you think like they need help, or they may suggest things that they can do to help you as well. So it's basically like what we said, an informal meeting. It's like a chilled back meeting. You have discussions back and forth, and then you carry on with what has been said. Now, the next thing that you can measure someone's performance is by asking questions. Now, for some people, being asked question on a shift just throws you off your shift. It throws you off balance. So if you are talking to a patient, talking to a client, and your supervisor asks you a question, you know, they will ask you a question. 9 times out of 10, if you trained well and you know your job well, you can answer it on the spot. But sometimes you may not be able to answer it on the spot. Sometimes you need to take your time and think about what it is. And this is a way how you can measure someone's performance and how they are performing within their job. So you can see if they know their job, how are they performing in their job? Are they able to answer questions off the cuff? So if I ask them a question, why did you ask the client a particular question, or what are you actually doing for them? You can answer them straight away. And this is how you will know what they will need to develop in and what they need further training in as well. So for now, individual training and developmental needs, now there's many methods in which you can do it. So you can get when you're looking at an individual person's training and how you can develop their needs, obviously there are certain methods that will spring to mind now, isn't there? So one of the things is that you can get feedback from people. You can get feedback from people. Now, these people can be anybody. So those people can be the people you work with. It could be service users and their families. It could be supervisors. It could be uplines. It could be local authority. It could be your colleagues, departmental workers. It could be anybody that you work with. They will now be giving feedback on you and how you perform in your role, won't they? Another way you can do that is getting them to complete reflective practice. Now, reflective practice is a very big thing, because as you get someone to reflect on their job and how they perform on their job as well, now if you get them to look at their job and you can get them to, and you get them to look at their job, you can get them to, you can get them to really look at, you can get them to really look at their, you can really get them to look at the job and to look at how they perform. So you're basically getting the individual to look at their performance and their practice and getting them to review themselves. Now, that is a very important key part of performance management. Reason being is that when the individual comes to you and they complete reflective practice, you now can see, okay, so they want to develop in communication skills, or this is how they feel they have done, or this is how they feel that they can work better. And so reason for that is because as part of that assessment, it's to see if it's going to be beneficial but also it will be clear whether there will be significant process afterwards. So yeah, so yeah, you know, performance management. So the SWOT, so yeah, reflective practice and stuff. Okay, cool. So yeah, during the probationary period, that is very key as well, because one of the reasons why is that yes, you will have to see how they're doing in their job and what they need taken forward, and that's a very key aspect. So as we were saying, they will look at reflective practice, and they will see whether it's good for the job, in it, and you will see whether or not they are progressing in their job, and then you will be able to see what specific help they would need as part of their job as well. Now, another method of management performance and measuring someone's performance is CPD. Now, CPD is continuous personal development, and that is in a particular field that you are in, i.e. nursing, care work, social work, therapy work, you know, yeah, nursing, care work, therapy work, working as a GP. All of that is key because it's continuous professional development. Now, CPD is not the same as a qualification, but you can do that if you want to. But it's basically you doing development as part of your role. So as part of your role, you are going to be looking at what you can do in your field to develop yourself personally. So are there any courses that you can attend? Are there any courses that you can do? Is there any people that you can work with in your job that can help you develop within your role? Or is there any you know, anything that you can do to help with your CPD? Now, 9 times out of 10, as part of your role, you may be required to sign up to a company. So the Royal College of Nursing maybe, or you as a social worker, you may sign up to Unison because it's a public service. Or as a care worker, you may sign up to the Care Workers Union, if there is one. And then as with that, within those particular unions or agencies, they will have their own standards that you have to meet. So as an individual, you've got to do certain stuff so you can maintain your role. So as in the, let's say the Royal College of Nursing, let's say, as a nurse or a care worker now, there were certain things that you have to do to be able to maintain your status. And so this is what people need to look at when they are looking to do a job. How many hours of CPD do I need to do? For me to get accredited or for me to be certified in a particular area, what do I need to do? What do I need to do? So let's now talk about the ways in which you can promote CPD. So when you are promoting CPD, there are many ways that you could promote that. So you can attend events. So these events would link to your role as in the industry. So as a nurse, you may attend an open day for nursing in certain areas. As a care worker, you may attend events for care workers, let's say. As a GP, you may attend an event for GPs, a one-day event for GPs. You may go to events that teach you about certain techniques. You may also get the chance to do some shadowing as well. So shadowing is basically what happens when you want to apply for the next job. So you're a care worker, you want to become a senior care worker, or you want to be a care supervisor, let's say. You shadowing a senior care worker or a care supervisor as well is basically you. It's basically you. It is basically you telling people. It's basically you speaking to people about and seeing how they do their job. So you will be seeing what they do, how they communicate, what it is you need to do that job. Another thing is that you may be supervising new staff. Now, if you said you want to be a supervisor or a care manager, you may be supervising new staff. So, or as a manager, you'll have to supervise new staff. Now, in that particular aspect, those particular new staff, they will need training from yourself. They will need specific, specific input from yourself and other senior partners as well. And now workshops. So those workshops can be anything from communication, disability workshops. You can look at other types as well, like what it is that will, this particular workshops could be one day, could be half a day, it could be for a whole week, it could be for 3 months as well, or it could be for a year. You never know. So those are all the ways that you can promote CPD within the job. And as a manager, as a senior partner, as well as a leader, it is very key that you stress the importance of CPD. But some of the questions that you have to ask yourself is it worth it? What impact will it have? What impact will it have on the individual? How will it improve their job? So let's now have a review of what we have done so far, and then we'll have some questions and answers. So at the very beginning, we said at the beginning,